Hi, welcome to Case 100, and this is Thoughts on COVID-19 4 years and 3 months later with a 61-year-old with progressive dyspnea. So this patient came in October 22, and you can see honeycombing, subpleural basal predominance, some cystic changes, and an overall UIP-like appearance. He came back in Jan 2024 with further increase in dyspnea, and we can see a little further subtle mild progression of disease. Now, we managed to at that time get the September 2020 scan where there was no pre-existing ILD, but we see these typical COVID-19 changes. And so we have a patient here who has documented COVID-19 in September 20, documented no pre-existing ILD, and now has a UIP-like pattern 4 years later. And so when we look at the status now, most patients regress or have regressed. Some still have subtle disease with curvilinear reticular opacities and ground glass. Some have fibrosis with traction bronchiectasis, and if the follow-up is more than 2 years, we do call it fibrosis now. Some have progressive disease like our patient with cystic change and honeycombing. Some have other complications, especially infection. We still don't know who progresses and how and why. And many of the post-COVID patterns simulate non-fibrotic or fibrotic hypersensitivity pneumonitis or UIP-like patterns. And if we don't take a good history or we don't have previous scans, we may miss the diagnosis completely. So I have shown all of these points with examples on the site where there is a longer video that you can look at. That's the QR code for the video and the site, and that's the link tree to all my posts, including the WhatsApp channel. Thank